besides our eyes and our tongue, our skin really demonstrates what's going on inside. And this is a great picture of what skin looks like. There's so many different things between oil glands and sweat glands and hair follicles and blood flow and so forth that is just amazing what the skin does. So I'm Troy Giles, and I'm a chiropractic physician specializing in health and well-being as a wellness coach to my patients and to other doctors as well. In this presentation we'll be discussing the skin, and this was quite a clever quote by Shakespeare. Our bodies are our gardens, our wills are our gardeners. So our wills, meaning the will we have to eat good, is so important, and our skin really represents what's happening on the inside. That's what's happening on the outside as well. So you can really tell a lot about a person just looking at their skin. There are many, many issues, a long, long list, from acne to boils, cellulitis, cystic acne, frostbite, ingrown toenails. That's still part of the skin. Psoriasis, shingles, sunburns, poisoning, warts, and so forth. There's just tons and tons of issues that our skin demonstrates. So the skin is the largest organ in the body, and you knew that, but that is such an amazing thing. We don't think of skin as organ. We think of our heart and lungs and liver and so forth as organs. But the skin is actually the largest detoxifier of the body. So skin has a major excretory function to eliminate stressors and toxins. So the glands to actively flush out toxins like urea, salts, ammonia, and sugars by sweating. Dead epidermal cells, hair, and nails also slough off to remove cellular waste. So every minute you lose 30,000 to 40,000 dead skin cells, which are restored by fresh skin cells. That's just amazing to me that's how much we flush off. So think about, people say, well, you've got to get a new mattress every 8 years because there's so much dead skin in your mattress. I don't know if all that's true, but anyway, you can think about if that many skin cells are being sloughed off. So every year the body sheds close to 9 pounds of skin. That's amazing to me. So skin absorbs everything that it's exposed to. So think about perfumes, makeup, deodorant. Sometimes people can become sensitive to their deodorants because of what they're having that under their arms all the time. And right there is such an exposure to our lymphatic system under our skin that's just a real important thing to make sure you're using a natural deodorant. So our skin tastes what we put onto it. So smaller molecules or substances are absorbed directly into the skin. Large and non-permeable particles are absorbed by glands. And even larger elements can be absorbed by going between the skin cells. So here's an example. Try this. Rub a garlic clove on the bottom of your foot and see if you can soon taste it as if you had eaten it. So the idea, again, absorbed by the skin would be small, large would be non-permeable, absorbed by the glands, and then some can actually go between skin cells. So the skin is a window, as we discussed. The skin is sometimes described as a window into the person's general well-being, including what is happening on the inside of both the mind and the body. So you think about like dryness on the hands or liver spots, oily skin. There's just so many different things you can tell by looking at the skin. So it can carry clues about the condition of other organs in the body, like liver spots. That's a great example of that. Visual indications of problems may be indicated by the way it looks. So common skin diseases, so like rashes, redness, inflammation, bronzing, or other dislocations or discolorizations, like sunburns, acne, herpes, herpes on the tongue or on the lip, wounds, eczema, dermatitis. There's also growth, and it's so important as doctors, as we look at our patients, to be able to say, this looks abnormal. It's abnormally sized. This growth, it's abnormal sized. It had no abnormal. It's elevated. It has abnormal borders. Make sure that we refer those patients into dermatologists. Skin cancer is so deadly, but yet so easily taken care of when it's done in the beginning. Again, hardness, dryness, or scaling, lesions, crusts, erosions, blisters, wrinkles, scars, thickening, fingernail changes, ear discharge or bleeding. So these are just some visual things you can think about. So realizing again that your fingernails are part of your skin as well, and different growth patterns or lumps and bumps can also indicate that there's things going on within other organs. So just for review, get a healthy, moderate exposure to sunshine. So these are basic skin care ideas. So a moderate exposure to sunshine. Vitamin D is catalyzed by UV radiation, so that's a great way to absorb your and bring it into your system, the vitamin D3. It's estimated that vitamin D influences 10% of the body's genes, so that's a very important vitamin. And then sunlight activates areas within the retina to trigger release of serotonin, which is a neurotransmitter. So I had a patient a couple years ago that was a sun worshiper or something, that she would look right directly into the sun for up to 15 minutes at a time. And I can't remember exactly what she was trying to do, but I wouldn't suggest that for anybody. Just make sure you get plenty of exposure. So as we're thinking about again basic skincare, diets to avoid, like things that are allergy creators that trigger skin problems. So foods that are most often linked with allergies visible to the skin would be like peanuts or tree nuts, milks, eggs, wheat, soy, fish, shellfish. So these are things that can create more skin allergens. Avoid unnecessary contact to chemicals or toxins. The Flint water, what an amazing, sad thing happened there. So avoid industrial pollutants as well as those found at home. Water for purification in the home to remove chlorine, aluminum, pesticides, fluoride, and arsenic from the municipal water. And avoid bathing in toxins as well. You just have to remember that things that go on our skin absorb. And I have to admit, I want to change, sometimes I've changed the oil in my car, or if I'm get paint on me, I'll just take some gas and rub it off. Not thinking, well, that's being absorbed, my liver's got to handle that. So we just need to be very, very specific as best we can. Here in my city, they put fluoride in the water, and it's something that we tried to fight. But they buffaloed the people, and we voted it in. But fluoride that they put in the water is actually a byproduct, and it's a very, very toxic thing. It's very easy to take fluoride. If you're into fluoride, it's very easy, very inexpensive to chew a fluoride capsule or a little tablet for your children if that's what you want. But to put it in the water where people absolutely need it is just stupid, because some people are very allergic. I've got patients that cannot now shower in the water. They can't go to outside their home where the filters aren't there, like to a hotel or something, because they get very allergic to it. So to me, anyway, I don't want to get political. Remember that stress is also a toxin. So, get out and walk and spend some time. Spend time in nature, deep breathing, meditation. So as we get really stressed, that also creates a lot of acidity, and toxins are released, and if we're unable to move those through, we get then skin issues. So many toxic ingredients are found in skincare and makeup products, like I was mentioning earlier. So avoid these items: synthetic fragrances, parabens, ureas, 1,4-dioxane. So you can just look there, petrochemicals, chemical sunscreens. I sell my sailboat in the summertime, and many times I'm out 4 or 6 hours in the sun, and I don't put on sunscreen. I put a hat on so I don't have direct on my face, but my arms don't get burned, my neck doesn't get burned. It's interesting, but everybody's always, let's get on, make sure we got all this sunscreen on. I think a healthy dose is appropriate. Resolve underlying health problems. So I love this. What are we eating? What kind of stressors are we doing at work? Are we able to detox? What's around us? What's in our cars? The byproduct of driving down the freeway. What are the pesticides we're putting on our trees and so forth? That's what's underneath. That's a great picture. So looking for clues when the skin changes occur, that's what you can say. Okay, the skin changes. Well, there must be something deeper. Then you can actually go in and ask kinesiologically, muscle testing, what's up? What's deeper? Is there an organ that's having trouble? So what's on the inside demonstrates on the outside. Important characteristics usually include size, shape, and color, like I was mentioning. So if it's raised, if it's irregular shaped, if it's dark brown. Those things we might want to consider getting into the dermatologist. Also important is where on the body the skin problems event is. Is it over an organ? Is it you can look at body mapping and seeing if that space is over, if that lesion is over the kidney area or the liver area. That would also be very important. And considering other symptoms that coincide, that's just one thing to do, is to look at the skin. Most common skin issues, we don't have time to individually cover the very long list of skin issues, but here are the most common. So acne, most common skin disorder in the U.S. Eczema, atopic dermatitis. So this Greek word for boils over, atopic dermatitis. Often seen in children, dry, scaly, or itchy skin, often found with people who have allergies, and important to avoid harsh soaps or other irritants. So if you have an allergy to wheat, for example, you can get atopic dermatitis, or I'm thinking of the one that's eczema, that plaquing eczema. So that usually is over joints where the skin will plaque, and you can actually scratch that plaquing area and remove it with your finger. That's part of eczema. Rashes. In the rash, is the rash accompanied by any other symptoms, such as fever, joint pain, muscle aches? So rashes on the back of the neck or around the arms with a slightly darker color than a person's normal skin hue may be indicative of someone with an increased risk of developing type 2 diabetes. That's interesting. Some velvety rashes could be a warning sign for cancer, like a cancer of the stomach or liver or kidneys. So if you've a velvety rash, is kind of just that sense you would have to touch it, but it has a sense of petting velvet. A purple rash on the lower legs may be a sign of hepatitis C infection. So it's very important to look and see where the rash is and what does it look like. Seborrheic dermatitis. So there's a good view of that, and that that can have that flaking as well. This affects 5% of those living in the U.S. 3 million cases per year. Called cradle cap in babies. I remember when my youngest when she was probably about a year or so old, maybe 6 months to a year, and she got a good case of cradle cap. I take her in with me into the shower and just let that shower beat down on her head, and big chunks would come up off of her skull or off of her skin. So it's a dandruff-like condition on the scalp. It also occurs on oily areas of the body, such as the face and back and chest. It's exacerbated by stress, genetics, yeast, cold and dry weather. Now, I find that a lot of skin issues are from yeast, just a skin breakout of yeast. So, working with Fungex, putting Fungex liquid tincture on an area like this could be effective. And you could even think about possibly putting some of the nutrient within the capsule of Fungex with something we'll talk to you here in a minute, Leptico. That might be able to put it on and keep those herbs in that area, and even kind of massaging them into this area could help and help fight any fungus or any other infections. Skin cancer. It's funny how clients will come to a practice because of sun damage or hyperpigmentation, but many will overlook cancerous lesions which really need attention. So that's what I'm saying. Make sure that you're paying attention to those weird-looking coloring and get them to the dermatologist. So skin cancer is often closely tied to genetics. So 1 in 5 Americans will develop it in their life. And I do need to be careful, but my sense about putting the sunscreen on, when I go to put it on, I just feel I repel it. I just sense a sense of don't put this on. But my father has various skin cancers that he's had taken off his face, so I need to probably pay attention there as well. Is the rise in skin cancer caused by the sun or because of the overuse of poisonous sunblock creams and lotions? Since the 1930s, skin cancer incidents have grown 1,800%. Has the sun really changed, or something else like today's nutrition deficient foods? So 5 signs of cancer: asymmetry, border, color, diameter, and evolving? Has it changed? Is it evolving? Is it getting bigger? So those are the 5 skin cancer signs. Great, that's a great thing. I'd make note of those and keep them on the wall or keep them in a place where you can refer back to them. So other common skin issues: psoriasis, warts, human papillomavirus, shingles, hives, sunburn, and so forth. So the internet has a number of excellent resources for depictions of various skin issues. So usually online resources are tied to a product sale. So be careful, but at least it'll give you an idea. You can look at those as well. So the treatment, I really feel that fungus is a big one, but it can be bacteria and so forth. So you always want to check for layers of infection. So when I say layers of infection, I mean that it's a small layer. It's 5 or 10% count of what normally would be there if you had a major cough or cold or a diaper rash or something like that. This would be a 5 or 10% count of that. So I think a lot of us suffer from layers of infection that go untreated, go unnoticed, because they're not enough to bring us to the doctor, bring us to the emergency room. So look towards removing layers of infection. Just as a review, Bacillus for the bacteria. Lympha-X isn't a lymphatic or isn't a infection fighter, but it sure does help to open up the lymphatic system where the drainage is when these layers of infection die off. Meta-X is to help get rid of metals. Microsite for microparasite, which is about a 40-day cycle. You take those consistent for 40 days. Paramac, remember to have your patients take it for 10 days on, 5 days off, but the larva will stay. So the larva in its egg shape, in that life form, isn't exposed. But once you quit taking the Paramac and the adults have died, that allows for the larva to hatch. Now that they've hatched, now they can be hit again. So you do a 10-day on, 5-day off cycle. So one cycle is 15 days, and you need to do this for a minimum of 4 cycles, so that's 2 months. Fungex, I find generally that fungus takes 2 to 3 months to work down to where it's up to 100%. Now when I say a layer of infection, I will go in with kinesiology and just ask, where is this? If I'm trying to get the patient to 100% gone, where is it? And sometimes it'll start out at 20%, sometimes 50%, but this is a way to determine, is it gone? Is it, besides what you're seeing on their tongue and their symptoms, is it to 100%, and can the patient stop taking this? You've got to have some way to determine, is it done or not? Even lab work sometimes, it doesn't show in the lab, but does that mean the parasite's clear, or is it just living within the cell wall of the colon and still they're happy and active? It's just not being seen in a stool sample. And then lastly, Viral-X for virus. This has lomatium oil in it and other factors that help to fight virus. So when I think about treating skin issues, I think first treatment of concerns for leaky gut. I find that most cases are linked to leaky gut syndrome. Great picture over here of this bucket leaking. So it's allowing toxins to pass through the gut into the liver, toxifies the liver. The liver can't get rid of the toxins, and they end up shunting to the skin. So there's always gut permeability issues with skin problems. So I address that first. So refer to the leaky gut syndrome video on YouTube. Next, for the treatment of leaky gut syndrome, then the support formulas would be Coltrax to support the colon tissue, Digest is a digestive enzyme with protease, amylase, lipase that help to digest and take the stress off of the digestion. Liver-G works with repairing liver tissue and liver support, detox. Vivaprofen helps to shut down the inflammation within the gut and replace good bacteria, where fluorescein is just good bacteria. It doesn't have the anti-infective or the anti-inflammatory aspect to it. So I usually start with Vivaprofen and then move into fluorescein after the inflammation is cleared. And the secondary treatment would be thinking about hormonal imbalances. Many times hormones, especially teen acne, is closely tied to the androgen hormones, which increase during puberty. So when I think about that, you can trace it back to the hormone imbalance and then toxic liver and colon. So test these symptoms and organs to determine whether you need to address endocrine or digestive system. So for addressing the endocrine system, hypothala works with the hypothalamus. That's the part of the brain that controls the rest of the endocrine system. So the hypothalamus controls the pituitary, which is the master gland, which then controls through feedback loops the other endocrine system, the thyroid, the adrenals, the pancreas, so forth. That's all done through a feedback loop up to the pancreas or the pituitary. And the hypothalamus is what controls that. So hypothala supports and repairs hypothalamus. Femiferm and maniferm support the male and female individually, each, but don't be surprised if your patient is calling for, your female patient is calling for maniferm, and vice versa. Sometimes femiferm is needed for male as well. So ask those questions. Adrenax supporting the adrenal glands, pituitary, of course, for pituitary and thyroid, and then PM Sync works with femiferm. So somebody who's having troubles with their cycle would take PM Sync and femiferm. So femiferm would be given from day 4 to day 20. Usually I give 2 to 3. And then day 21 to day 3 is PM Sync. So PM Sync is supporting the PMS and all the symptoms that accompany that set of symptoms. So again, femiferm, day 4 to day 20 of the cycle on a 28-day cycle. Day 21 through day 3 is PM Sync. Okay, so other supporting factors here for skin issues. Fulvocava, this helps normalize pH levels and aids heavy metal detox. Phytochemicals with electrolytes that aid in digestion. It also has the ability to absorb and help absorb nutrients as well. So people are having troubles with absorption. Zinc Comp, zinc aids in wound healing and treating acne, herpes, and aging skin. So we know zinc, that's very important. It's also effective for the prostate. Redoxin is a super antioxidant which improves skin coloration and elasticity. Also lightens age spots and softens skin. Very effective at repairing skin tissue. IntegraCell reduces the effects of cellular oxidative stress and helps prevent against free radicals. So 1 scoop of IntegraCell has 8,000 milligrams of type A antioxidant. Type A antioxidants will knock out 1 million free radicals per milligram. So 8,000 milligrams times 1 million equals 80 billion free radicals that 1 scoop of IntegraCell will take out. So realize that we're creating free radicals all the time through normal cellular respiration and through just normal function, breathing bad air, exhaust, food, water. So IntegraCell is a tremendous, love it. That helps so many people. And then Releptico has lamatium oil in it, and it's a tremendous balm. I use it every day. I put it on my skin. I've got some dry skin issues, and I actually even have some plaquing on my knees. So I put this on, and it keeps it from cracking and drying. I still get the plaquing, but it does knock it so that it doesn't bleed and so forth. So it's a natural topical skin care to rejuvenate and relieve tissue and muscle injuries. It has antiviral, antibacterial, as well as increases circulation. So it's a vasodilator to help bring blood flow to the area. Tremendous. I want Inno-Vita to always carry Releptico. Love that one. Skin warts are kind of a toughie. Depends on if it's a seed wart or if it's a regular wart. Seed warts they're just difficult, and my daughter suffered from it, and I tried everything on it. I at that point didn't have Releptico to try, but that would be one I would really try, because most generally warts are viral, and the lamatium oil is the greatest thing ever, and that's what the North American Indians found was very, that's what they used to treat. It's a tuber grown along the Wasatch Front here. They used it in the 1900 outbreak, I believe, of the plague in San Francisco. So very effective viral. So I would do the lamatium or the Releptico, and maybe put it on and then cover it over with a Band-Aid. Also, taking Viral X internally would be effective. Garlic is another one that's been used. Finally, what we had to do with my daughter to get rid of her wart was the dermatologist put something on it that triggered a reaction. She had to take something first. Can't remember if it was orally, and she had to take something orally, and then she had to paint it with something that created an immune response that ultimately, I mean, it was amazing. And I can give you the name of the doctor who did this here in Utah, and you know, if you're not getting result after the things I've just suggested, call me. You can get a hold of me through Inno-Vita, and I can tell you the doctor's number and what she did. It was amazing. It finally took it away, and my daughter was, I mean, it was up around her fingernail, along the side of her whole finger. It was just very obnoxious, but that finally took it.